process. People will continue giving birth, and children are going to continue getting, we are going to continue getting biometrics from children from the age of 7 years. Remember, why the age of 7 years? I can see that question on your face.
Yeah.
You're about to ask.
Yes.
Scientifically, that is when a human being features are formed at the age of 7 years. So it is good to take biometrics for children at that particular age. And we will have many more children getting to 7 years every other year. So registration will be continuous, really. And Rome was never built in a day. There is room for improvement in everything. We already have gotten feedback from the field, from stakeholders, from parliament, members of parliament, from other groupings, private sector, and other teams from the Ministry of Health. Therefore, whatever the feedback they give us is what we are trying to input, or we have already input for publication.
Okay.
But should there be a challenge, anything that is made by man can also be corrected by man. It is only natural calamities that you cannot stop. You cannot stop the sun, you cannot stop the moon, you cannot stop the rain. But if it is a document that we have written, we are bound to relook into it as we progress, so that we can do any rectification, should there be any. But so far, so good. I'm convinced that once we start, there's not going to be a setback.
Is it true that NHIF staff will reapply for their jobs under SHIF?
These are administrative issues, really. And I think it would be wrong to preempt everything that has not even happened. And if communication has not been done to them, why worry? I am not sure. I have not seen any communique that
and there are no intentions of such
that has requested them to reapply. So should there be such a communique, then I will come here and we discuss.
Okay, absolutely. Okoich Kiplagat on X asks, what is the status / plan for the absorption of the healthcare professionals who were contracted under COVID-19 response project?
Those are issues, human resources for health, and they are lumped up into what you have seen today. And quite a number of issues that behind the scenes we are discussing with PSC, discussing with the county governments for a possible absorption. However, I think it is important that we give it time so that conversations can be concluded and we do not have confrontations in future. I know we have a contract that is ending in May from the national government, and we are on top of it.
Justus Muvenge asks, ask Madam PS why they are exporting nurses abroad at a time when the country is grappling with the shortage of nurses.
Really, we are not reinventing the wheel. Export of labor has been there from time immemorial. Currently, Kenya exports about 3,000 workforce across the globe. So it's nothing new that we are doing. All we have done is to structure, to have a government-to-government engagement for people to be comfortable in wherever areas that they have gone. And especially, sometimes you find very young people have gone to new countries. They do not know their way around. And maybe even their visa, they miss on work permits or small, minor things. It would be important that when a government knows who is out of the country, where they are employed, who has employed them, how much they are earning, and any other issue. Should there be a diplomatic issue, row, that would come, then the government has the mandate to come through and protect its citizens. So we have really not done anything new that has not been done before. Secondly, the production of human resources for health is at its moment. Because KMTC alone, if you look at data in the last 3 years, coming from a mere 7,000 graduates to about 22,000 graduates. That is the highest number of graduates that we have in any institution in this country, not even Nairobi University or any other university. Therefore, that shows we have new human resources for health that are graduating every other year, and we need to fix them either locally or internationally.